Thanks for joining us, Dr. Hagelstein. I know you've had experience in treating some childhood head injuries, specifically concussions. Could you share with us some of the experiences that you've seen in terms of commonalities among kids who come in with these types of injuries, age groups, gender, severity, symptoms across the board?
Yeah, no, it's a good question. So concussions have been in the media a lot more, basically with professional athletes, but then also college athletes and then also high school athletes. However, I will say that concussions can span all age groups, and it can be a little difficult, especially in the young kids who are 0 to 2 who can't talk and say that they have certain symptoms. And it can be difficult even in some athletes to say, yes, you have a concussion or not, because they may not come forward because they don't want to leave the soccer game or the football game. But I will say that a concussion is really based on the child's symptoms. And so there are 4 categories of symptoms that we look for. So physical symptoms, cognitive symptoms, emotional symptoms, and sleep symptoms. So when we look at physical symptoms, this is the headaches, the vomiting, the nausea, blurry vision. For the cognitive symptoms, children can have just feel a little bit more blurry, a little bit more foggy, just hard to concentrate, and they might forget things and then also forget the event itself. And then for emotional, some children may be more irritable, they could be feeling sad as well. And then for the sleep, concussions can definitely affect the sleep. Children may sleep more or children may sleep less. And so concussions can give a varying amount of symptoms. Now in these younger children, because they can't say, because they can't talk what their symptoms are, you're going to look for behavioral issues. Are they more irritable? Are they vomiting? And then for older kids, you can ask more questions.
So some of those, as a parent, I'm sure can be really concerning and a little bit scary, especially if you or a kid just comes home from the soccer game and they're just acting different and you don't know what to do. Obviously, kids are kids, they're going to get hurt, they're going to be active, you can't stop, that's what they should be doing. And so what kind of advice, with all of that in mind, would you give to a parent that wants to maintain safety and really make sure that all measures are being taken to try to avoid some of these things?
Yes, and so there's a lot of research going on about that as well. And so what has been proven to be effective to prevent concussions? So one thing is to actually decrease tackling in some contact sports, such as football and hockey, especially during sports practices. The other thing is to look at people's equipment, the athletes' equipment, to make sure it's not faulty, and then also make sure that the helmet fits adequately. Now, helmets are not going to protect against concussions. But they can lessen the blow. And so a lot of research is coming out about helmets themselves. And I think in the next couple of years, we're going to have, helmets are really going to change. And then lastly is education. So educating the athlete, educating coaches, educating parents, educating everybody. Because that is where people are going to recognize concussions and then also know what to do if a child has a concussion. And so there's a couple of different resources in which you can go to. Mainland Health has a fantastic physical therapist and have great information about concussions, and in fact they have vestibular training as well, which can be very helpful for the kids who have severe concussions, but physical therapy can be helpful even for kids who have mild concussions. The other site that I highly recommend is cdc.gov, the Heads Up program. So there are links for coaches, parents, and athletes. And actually on the coaches link, there is a 30-minute free session for coaches and what to do with concussions. And so I recommend that.
Well, thanks so much for sharing all of your insight with us and being with us here on Health and Wellness.
Yeah, thank you. Appreciate it.
Yeah.
At Mainland Health Center at Exton Square, we offer a variety of different services. And we offer family practice, we offer an urgent care, we also have imaging modalities here, CT and MRI. We can also draw labs here as well. And then located on our campus, we also have physical therapists.